say
that we think will make the programs better.
But can you honestly say that by turning Medicaid into a block grant and giving it to the states, that you can cut $770 billion out of that program over the next 10 years, and it's going to have no impact on legitimate recipients?
These are increases that have not come yet. So by repealing Obamacare and the Medicaid expansions, which haven't occurred yet, we are basically preventing an explosion of a program that is already failing. So we're saying don't grow this program through Obamacare because it doesn't work. Prevent that growth from going because it's not going to work. It's going to hurt people who are trying to help. It's going to hurt hospitals and states, and give the states the tools that they're asking for. Indiana is a perfect example. They have a fantastic Medicaid program that Mitch Daniels created in Indiana that is popular, that's successful, that's working well, but Obamacare prevents it from going forward. We want to give states like Indiana, states like Wisconsin, the tools they need to make these benefits work for their populations, and we don't want to push more people into a failing program. And by not pushing people into this failing program, we do save these kinds of dollars.
I want to pick up on this because I must say I didn't understand this. Are you saying that as part of your budget you would repeal, you assume the repeal of Obamacare?
Yes.
Well, that's not going to happen.
Well, we believe it should. That's the point. This is what budgeting is all about, Chris. It's about making tough choices to fix our country's problems. We believe that Obamacare is a program that will not work. We believe Obamacare will actually lead to hospitals and doctors and healthcare providers turning people away. It's a program that basically puts Medicare under the control of 15 people on a board that will determine what kind of benefits people get. That's a rationing board, however you slice it. We don't think healthcare is going to be improved in this country. We think it's going to look very ugly over the next couple of years. And that's why we're going to propose replacing Obamacare with patient-centered healthcare, with a better healthcare system for everybody, for the poor, for people in the states, for Medicare, so that we can actually have affordable health insurance for everybody, including people with pre-existing conditions, without costly government takeovers, which is what Obamacare represents. And yes, our budget does promote repealing Obamacare and replacing it with a better system.
All right. I want to pick up on this Medicare, because what you would say is that starting with people who are now 54, and you reportedly wanted to raise it to 56, but then there was some political pushback, but starting with people who are now 54, that you would start to give them, when they become of age, a government subsidy, a voucher, whatever you want to call it, premium supports, to help them pay for their health care costs. Now, you know, I don't have to tell you, this was a big issue in the campaign between Romney-Ryan versus Obama-Biden. They think they won, and they think that's one of the reasons they won. And there are, Congressman, a lot of independent studies that say if you put this into effect, the net effect will be that seniors will end up having to pay more of the share of their health care costs.
Well, first of all, it's not a voucher. It's premium support. Those are very different. A voucher is you go to your mailbox, you get a check, and you go buy something. That's not what we're saying. We're saying let's convert Medicare into a system that works like the one I have as a congressman. It's federal employees. You have a list of guaranteed coverage options, including traditional Medicare, for your future health care needs. Medicare subsidizes your plan based on who you are. Total subsidy for the poor and the sick. Less of a subsidy for wealthy seniors. Doing it this way, harnessing the power of choice and competition, where the senior gets to choose her benefit that's comprehensive, is the best way to save Medicare for future generations. This guarantees that Medicare does not change for people in or near retirement, and it also guarantees for those of us who are under the age of 55 that we actually have a Medicare program when we retire. The problem is Medicare is going broke. The other problem is Obamacare does such damage to Medicare that it's going to damage the program for current seniors. We don't want that to happen. That's why we're proposing these reforms, which save and strengthen the Medicare program, not just for my mom, but for my generation as well. And I would argue against your premise that we lost this issue in the campaign. We won the senior vote. I did dozens of Medicare town hall meetings in states like Florida explaining how these are the best reforms to save and strengthen the Medicare program. And we're very confident that this is the way to go. It has bipartisan support. It's an idea that came from Democrats in the first place. And we think it's really the best way to go, because the alternative here of having a choice-based system where you get to choose the plan that meets your need is 15 bureaucrats making these decisions in Washington, which are the new Obamacare board, which we repeal.